So we're going to spend a few minutes talking about fibromyalgia and irritable bowel syndrome. I'm Dr. Martin Rutherford. I'm a chiropractor for 36 years. Currently, the largest part of my practice is relative to me being a certified functional medicine practitioner. This is my associate,
Dr. Randall Gates. I am a board-certified chiropractic neurologist as well as being a chiropractor.
And together we have melded our two paradigms, our two disciplines, into a approach that has attracted and ultimately developed a chronic pain practice, of which fibromyalgia is a significant portion of the patients that we treat. We treat peripheral neuropathy patients and dizziness and vertigo and balance and chronic fatigue and restless leg, a lot of different neurological issues. But fibro seems to be one that's starting to maybe there's a lot of data that's coming out there now, so we're sharing with you what we've seen, what some of the things we've utilized to help people. And so today we're going to talk about just a few minutes on fibromyalgia and irritable bowel syndrome. For those of you who are not yet aware, which is probably still a lot of people, are not yet aware how much your bowels, your small intestines and your large intestines have to do with you feeling the way you do, this might be an interesting few minutes for you. I did not know when I got into this that I was going to, because this has been an evolving understanding, I did not know that I was going to have to become conversant with thyroids, immune systems, stress mechanisms, and bowel problems, even though I've had them all my life. So, but I'm going to defer to Dr. Gates for the next few minutes. Dr. Gates is our research maven. He seems to be able to stay up on this stuff almost to the minute. So he's going to share with you some of the things that we've been utilizing and some of the new research that's out there on how much the bowel contributes to your particular specific pain syndrome, your fibromyalgia pain syndrome.
So, as we've discussed in a lot of our videos, we've talked about it several times today. We just did our third hour-long broadcast on fibromyalgia because we're trying to present these fibromyalgia updates, because so much new data is coming out weekly, basically, on the causes of fibromyalgia, and the reasons why people feel so much pain and oftentimes don't respond wonderfully to the current treatments out there. Now, with that being said, there are several comorbidities, as they're termed, for fibromyalgia patients. All that means is that a lot of fibro patients have migraine headaches, IBS, irritable bowel syndrome, menstrual cramps. They can have what's termed interstitial cystitis, things of this nature. Now we're seeing peripheral neuropathy. And these conditions kind of all are associated in this intertangled web of dysfunction. Now, relative to IBS, we've done talks on IBS at length, as well as certain facets of IBS. But let's go through IBS to begin with. Irritable bowel syndrome is basically characterized as having alternating constipation or diarrhea, or more having only constipation or more having only diarrhea. It's commonly associated with gastrointestinal pain, abdominal bloating after somebody eats. A significant percentage of the population is affected with IBS. Statistics vary, but it's pretty large. You can go back to our IBS hangout or broadcast that we did on our website, powerhealthtalk.com. With all that being said, we see that there are certain things that are wrong with IBS patients and IBS patients who have fibro, or fibro patients who have IBS. In essence, we can have food allergies or food intolerances. So you eat milk or you have gluten, and your immune system starts to attack those foods. That can cause some of the bloating or the distress. Today we just talked about an article relative to fibro patients feeling better being off of gluten, as an example. Now with IBS, we can also get something termed small intestinal bacterial overgrowth. That is where we get too many bad bacteria growing in the intestines. This is a new entity in the gastroenterology world. A lot of gastroenterologists argue on how to really diagnose it because they can't figure out what the upper limit of normal is on their test for SIBO. But we're seeing that SIBO, most people agree, is now a common entity to IBS sufferers, and now it's being acknowledged in fibromyalgia patients who have IBS as well. And then other facets that go into IBS include the nervous system, so depression and anxiety. A lot of patients purely with IBS have depression and anxiety. I think the estimates are upwards of 80%. It's really, really common. And those neurological signals that come from the brain going to the gut can cause the gastrointestinal tract not to get enough blood flow, It can cause the gastrointestinal tract to become more sensitive to pain, kind of like all of you fibromyalgia patients out there where you have that sensitivity to pain. Same thing can happen in the gut. So if I use the example of you eat a cheeseburger, it's so analogous to having a large pizza. So you feel like you've just ingested a huge amount of food when you haven't. And that distension, or those symptoms, create the distension. So in terms of how you help someone with fibromyalgia who has IBS, we go back to the causal...
And all of that can cause the infamous leaky gut.
Right.
And the reason I mentioned that is
exactly.
for the patient that walks in the office and says, well, you're going to put me on this diet? Like, I eat better than that already. And the leaky gut will ultimately affect by having undigested food that should be going in the toilet, going through your gut, into your bloodstream. You can look at our other stuff in which we talk about. Most fibromyalgia patients have some sort of an autoimmune component, which means you already have antibodies, you already have parts of your immune system flying around your body looking for things to kill. Now you have an undigested food particle in your bloodstream that doesn't belong there. Zap, you have a food allergy to broccoli or spinach. I mean, that's an extreme example, but we have seen those in this particular area. So now the person's really confused because they're eating like $1 million, and they feel like they were eating that cheeseburger.
Right, exactly. Yeah. Exactly. So then basically so many things fall apart once this whole process starts in. It's more complex to fix it than just putting somebody on a diet. And so we look at all these factors in terms of how we're going to manage a case of fibromyalgia who has IBS as an example. And really, in many cases, helping the IBS may help the overall condition or may set the stage to help the overall pain.
It seems like for us, it just sets the baseline.
Mm-hmm. It is the foundation.
It's the foundation. And once the gut is under control, now you can see what's left, because the point I was going to make at the end was that we're not saying that irritable bowel syndrome is fibromyalgia, but we're saying it's a major component.
Right. And then we talked about studies where we're discussing the drugs that are used for fibromyalgia patients, as I belch. There goes my IBS, I'm kidding. And basically, prednisone, which is an immune drug that basically calms down the immune system, they've given that to fibromyalgia patients with basically no success. Because you can calm down the immune inflammation, but so many other things that happen neurologically for someone with fibromyalgia to feel that pain, like small fiber neuropathy, like central sensitization. Look over our other videos, we discussed that at length. But in essence, I think that covers fibromyalgia relative to IBS.
Yeah, it's a key. If you have fibromyalgia, you have a bad gut. They've termed it irritable bowel or whatever they termed it, but they've termed it irritable bowel. That doesn't get better. Somebody doesn't figure out what's wrong with that, doesn't resolve that, you're not going to get any long-term response from anything that you do at all, based on our observations. So.
Okay.
Yeah.
I think that's all we really need to say on the subject. If you want to watch other videos, go to www.powerhealthtalk.com. You can like us on our Facebook page. You can YouTube Dr. Randall Gates or Dr. Martin Rutherford relative to these subjects. And all of our videos come up. And thank you for watching. Hope it was helpful.